back to Body Beautiful. We are here with Dr. Thomas McNamara, plastic surgeon, board certified, I might add. We'll be taking your calls about plastic surgery. We've already got some calls. Phone number to call, 800-440-4884. And remember, any advice we give you today, you're going to want to consult your own physician as well. Big question, before we get into the before and after pictures, I mean, how do you know if you're a candidate for a facelift or the plasma, say, for instance?
Well, it all depends on the severity of the surgery that you're having, or
the problem that you have, right? How deep the crease is.
Well, yeah, exactly. And you know, first of all, you have to see if you're medically able to have the surgery or the plasma.
Very important consideration. We all know Kanye West's mom. You know, she was not in the best of health, so health is very important before you. Let's go ahead and look at some of those before and after pictures. I think we've got them there. There we go. Okay.
So a facelift that goes around the sideburns and then down along the ear and then back. You sort of see the strength of the operation is out of the jowling and then the neck region. And also you can sort of see that we also did a forehead lift where we improved and did an eye upper lid blepharoplasty where you remove the excess skin on the eye, and then a lower lid blepharoplasty where you get rid of some of the bagginess to the eye.
Okay, and let's go into the next picture. And what's happening here?
Same, but
she looks happier. Is it because you get a scowl when the face starts to drop?
You do, and this actually helps. You know, she said that everyone thought that she looked unhappy and tired, and even looking around the eyes, where we've done again an endoscopic forehead lift, which is minimally invasive, and then also the upper lid and lower lid blepharoplasties, getting rid of the excess skin and fat in that area, and then just making the neck look cleaner. And
that's a very subtle, nice job. And you've seen the ones, some of them in Hollywood, where they've gotten a little excessive, and everybody's that surprised look.
Exactly.
So okay, and this woman here.
Oh, this is an example of plasma resurfacing.
So it took care of, what are those, age spots, brown spots from the
age
sun?
spots, exactly. Age spots, brown spots. It also helps the texture and tone of the skin.
And we didn't talk about that with plasma resurfacing. Also has some medical effects that will clear up
right. It helps treat actinic keratosis, which is a pre-malignant lesion. But what's the beauty of this is that it helps cosmetically as well as medically.
Okay, and last picture here?
Oh, this is just, I threw this in because it helps with the hands.
People ignore their hands.
Oh, no, I don't know. Most of the women I deal with love it because of their hands.
Excuse me. All right, your clients.
Oh, yeah.
But, but it's, they're always worried about their faces, and then they put their hand up, and you see this all, so.
Exactly. So you do the face, and you're like, well, my hands are,
You've got to take care of all of it.
Because it is FDA approved for full body.
We're talking about the plasma. Portrait plasma, FDA approved, very important as well. Let's go to a phone call from Fremont, Dolaire. Do you have a question for the doctor? Hello, Dolaire?
Hi, yes.
Yes.
I recently had a forehead lift about 2 months ago, and I have one side of my forehead is still kind of, it has a throbbing pain, numbness, and I want to know why that one side hasn't healed compared to the other side, and how is that normal?
And you're saying you had a facelift 2 months ago, and you still...
No, a forehead.
Oh, a forehead lift, and that was 2 months ago. What do you think, doctor?
Well, there's always variations on normal, and the biggest thing is to make sure you go back to your surgeon who performed and ask those questions to him, because there's various techniques that are available. There's actually the cases that I use. I do an endoscopic technique where I actually make small incisions in the forehead and actually place a device that will dissolve in 6 months. Now, oftentimes I do get some complaints. It's more of an annoyance than a real strong complaint.
So, doctor, you're advising that she check it out.
Thanks.
We're running out of time, but I want to take another call. Nikki from Hayward, do you have a question for the doctor? A quick one? Nikki, you with us?
Yes, I am.
Quick question for the doctor? You're on the air.
Yes. Okay. I'm wondering, I'm 31 years old, and I have high blood pressure. Okay, I've had 3 C-sections, and my last C-section scarred my stomach tissue, and I'm wondering if it is safe for me to have a tummy tuck.
Thank you, Nikki. We are so out of time. Can you answer that quickly?
Depends. It depends on. We have to get you medically cleared first, and then we'll see about the.
Okay, thank you. Thank you for joining us. We are out of time. I told
Right.
you it would go quickly. That's our
Okay.
show. For more information on Dr. Thomas McNamara, call him 925-866-0177 or go to drmcnamara.com. When you call his office, mention Body Beautiful, you'll be able to receive 10% off injectable treatments, including Botox. Thanks for joining us. See you next week.